Hello, I'm Dr. Bruce Eimer, and I'm here today to briefly tell you about my training in pain control hypnosis. I would like to tell you what I do, what I teach, and why this course would be important for you to take. First of all, hypnosis is one of the most tried and proven and oldest non-drug treatments for pain, dating back to ancient times. It has a rich history, and in the last 30 years, there's been a plethora of research validating the empirical effectiveness of hypnosis for pain control in the control of both acute and chronic pain, both benign as well as cancer pain. Now, because most health professionals have little formal training in the treatment of chronic pain, there is a lack of well-informed, well-trained health professionals to help people that suffer from persistent pain syndromes. The American Academy of Pain Medicine has documented that, based on the research, that multidisciplinary treatment for chronic pain is the thing that should be emphasized. However, unfortunately, so many people with persistent pain syndromes that don't get better go from doctor to doctor and are told that they have to learn to live with their pain. In addition, because hypnosis is such an effective but difficult treatment for a practitioner to utilize effectively, it is hard to find a clinician who does hypnotherapy or a professional hypnotherapist that actually knows what they're doing in the treatment of pain. Being effective as a hypnotist or hypnotherapist is not enough to treat any clinical condition. One must have a good knowledge of that particular condition or disorder, and have extensive experience in training in treating that condition. So we strongly emphasize that people stick within their area of expertise, their discipline in which they're either licensed or trained in using hypnosis. And because there is a lack of professionals who know how to use hypnosis effectively for treating pain, I launched my training program for training professionals, health professionals, in using hypnosis for pain control several years back. And I would like to tell you a little bit about it. There are opportunities to take my courses at various conferences, as well as through my own organization, Bruce Eimer, PhD, LLC. And more information can be obtained on my website, which is bruceeimer.com, or on the other website that I started called hypnosisce.com. Anyway, enough for the advertisement. Let me just briefly tell you about hypnosis for pain. The best definition of hypnosis is that it's a state of mind in which the critical faculty of the mind, that is that little voice in your head that analyzes and criticizes and judges, is temporarily suspended, and wherein selective thinking is established. Hypnosis is the royal road to communicating with that vast part of your mind, which is called the unconscious mind, which is the feeling mind, which controls all of your feeling reactions, your physiological functions, and your habits. The unconscious mind has a language of its own. It's a language of feelings and images and impressions, and it's not logical. It's very concrete and it's very literal. It's only concerned with survival. It doesn't have a memory system, as does the conscious mind, okay? And its responses are based on the survival response of fight or flight, okay? The conscious mind, on the other hand, is the part of your mind that controls all of your deliberate choices and actions, the things you choose to do consciously that you know that you're doing. Okay. Planned activities. Okay. Now, pain has a language all its own. Pain comes on effortlessly. Okay. And hypnosis is effortless. You can't try to get out of pain because that doesn't work. And you can't try to be hypnotized. You just have to let it happen. All right. Pain is very right brain. That is, it operates based on concrete illogic, and it is feeling based. It's based on sensations and emotional reactions. And of course, pain is a signal that there's something off, something wrong that needs to be attended to. So it is designed by our unconscious mind to promote our survival. Okay. Hypnosis is the language of feelings, the language of impressions, and the language of pictures and images. It also is based on right brain language. Persistent pain is a negative hypnosis state. It's a state of persistent negative, uncomfortable trance, while hypnosis is a state of mind in which one is either neutral or positive. Okay. Now, I am teaching a program for health professionals to use hypnosis to help people to control pain, alleviate pain, and manage pain. In this course, which is the basic course, is a 2-day course, Fundamentals of Hypnosis for Pain Control. We cover the nature of pain, acute pain, chronic pain, but different types of pain. We cover the neurophysiology of pain and the mechanisms of pain, the understandings that you need to have about the medical aspects of pain, the neurology of pain, and the psychology of pain. Okay. We also cover the basics of what hypnosis is and how it can be effective in the treatment of pain. Okay. Then we talk about how to properly assess or evaluate somebody who is in pain, who comes to you as often a court of last resort for hypnosis to help them get pain relief. We talk about all of the necessary components of doing an evaluation that will provide you with the information to determine how to proceed. Okay. Then we cover how to introduce hypnosis to a person in pain so that you can help them to understand why hypnosis can be very effective in helping them to deal with their pain more effectively and have less pain, and also to not suffer unnecessarily. Okay. So I cover the fundamentals and the principles for developing a pain control hypnosis pre-talk that's individualized to the individual that you're treating based on your pain evaluation. Okay. Then I cover how to choose an appropriate hypnotic trance induction for somebody that's in pain. And of course, that's going to vary depending upon the type of pain they have and also your preferences for the type of inductions that you like to do. Okay. I teach people who take my course, take my training, how to determine what is the best type of trance induction procedure or protocol that would be most effective for them to use based on their preferences and their verbal skills. Okay. Then we cover hypnotic language and we talk about comfort talk versus pain talk. We talk about pain imagery and pain relief or pain antidote imagery and how that lends itself to the use of hypnosis in order to help people to replace their often catastrophic pain images with pain relief images. Okay. Then we talk about, I teach several hypnotic trance inductions that are very well suited for working with pain patients. And they're also very effective in working with patients with other disorders such as anxiety, post-traumatic stress disorder, and depression. Okay. And we cover those inductions in detail. All right. I teach the 8Ds model of pain control, which I developed, which essentially helps you to choose pain alleviation strategies that are appropriate for your individual patient. I teach the AWARE model for doing therapy, which essentially is an acceptance-based model for doing psychotherapy and hypnotherapy. Okay. Then what we do is we cover the formulation of pain treatment strategies based on your assessment of your client or patient. Okay. The course is also going to include, besides lectures, it's going to include live demonstrations and clinical videos, as well as practice sessions that are supervised so that you can practice the techniques that you learn. Okay. We also cover the differences between the direct suggestion and hypnosis approach and hypnoanalysis. This isn't an extensive course in hypnoanalysis, but you learn the basics and you learn how to use ideomotor signaling as a way of speaking or communicating with the unconscious mind without the use of words, as a way of deepening trance, confirming the acceptance of suggestions, and also exploring the emotional factors that might be maintaining or exacerbating a person's chronic pain. Okay. Finally, what we do is we cover the teaching of self-hypnosis to make pain control strategies portable. So I teach you how to formulate a pain control exercise based on self-hypnosis to teach your patient so that they can take pain control with them. And I also teach you how to use post-hypnotic suggestions and post-hypnotic or post-trance imprinting for pain alleviation. Okay, well, that's pretty much it. I'm going to be teaching this course, this 2-day course, in a variety of venues coming up now in the winter, fall, and summer of 2024. It's going to be taught at the annual virtual hypnosis conference and scientific meeting of the American Society of Clinical Hypnosis. You can go to their website, which is asch.net, to register for that, to find out more information. I'm going to be teaching at the International Medical and Dental Hypnotherapy Association 2024 Hypno Expo in you can go to imdha.com to find out that. I'm also going to be teaching at the National Guild of Hypnotists in Marlborough, Massachusetts. I'll be teaching courses on hypnosis for surgery prep, as well as hypnosis for pain control. And you can go to their website, ngh.net, to register and to find out more. You can also go to my website, bruceeimer.com, that has links to all of the above. Okay. Plus, I'll be also offering the course in my private practice virtually, right? Go to bruceeimer.com to find out more. Thank you for listening, and hope to see you sometime at one of my courses. Thank you.